Mother to Baby OTIS Legacy, a Q&A session with Lynn Martinez. How many years have you been involved with the organization of Teratology Information Specialists, known as OTIS?
Well, I started working with the Utah Pregnancy Risk Line, as we were then known, in 1984. And in 1985, what I think of as the first OTIS meeting was held in Philadelphia. And that was a gathering of people who were just starting to do information services around the country. There were only 2 or 3 of us that were doing that, but getting together with some of the people from the CDC, some of the people from the federal MCH Bureau, and people from Canada, folks who've been working with, as I like to call it, dysmorphology for many, many years. And so that's how I first kind of got involved in the idea of networking with other people who were trying to do the same thing and not try to invent the whole area on our own.
How did you come to get involved with OTIS?
I've been working for 10 years in family planning and women's reproductive rights. And I saw that with the advent of Roe versus Wade, that the area that would be the most difficult for women to navigate and to maintain autonomy in would be pregnancy. And the need for women to have accurate, current, good information upon which to base their decisions about their pregnancies seemed to me to be the next avenue that I wanted to be involved in, because my focus had been on advocacy and continued to be on advocating for women during their pregnancies, women while they were breastfeeding, that kind of thing. And this just seemed a good fit for that.
Looking back at your career, what are you most proud of?
As I looked at that question, it occurs to me that I'd prefer to talk about what I am grateful for, because pride, feeling proud about something kind of puts things onto myself. And I feel like everything that I've done in this area has been done with a team of people of whom I am very, very grateful to have worked with. I'm grateful for having been in at the beginning, so to speak. I mean, dysmorphology, of course, was already a discipline, already a field, but the idea of translating the research and the science from that area into patient education, provider education, seemed to me to be something fairly new that we could develop for ourselves in a way that we thought was appropriate. And so I'm really grateful for having been able to do that, and grateful for the team that I worked with, the people that started this whole thing.
What has been your favorite thing about being a part of OTIS?
Definitely the people. My favorite part has been the people and everything that I've learned from them. I mean, I've been able to know brilliant, um, wonderful, kind, creative people from whom I've learned tremendous things, tremendous lessons beyond the science, beyond the work itself, but just life lessons that have been so important for me, that I've learned from so many folks within the organization. And that's been the most important part for me.
If you could provide one piece of advice to someone looking to get involved with the work OTIS does, what would it be?
That piece of advice would be always be curious, be interested, and primarily be skeptical. Don't take the word of any organization, any other group. Know the primary source of the data, the research, understand it, know how to critically evaluate it, and do that. And do that with partners, with people with other expertise, but be willing to do that and not just take a piece of information that's been prepackaged and then push that out to your clients. That's not fair to them, and it's certainly not fair to you, because the funnest part of all of this for me was the idea that I could learn to be critical and learn how to evaluate the information that I was then responsible for when I put it out to patients and for healthcare providers and others to use. So that's important. And the second thing, I have to give you a second one, and that's this. Always, always, always listen to those who you're serving, listen to your colleagues, listen to yourself.
What's next for you at this stage of your career and life?
The things that I'm working on now have to do with dysmorphology, but also other things. I have decided to uh, become, well, to revisit my creativity. I like to write, and I've done a lot of writing in my life. Most of the writing that I've done has been very kind of technical and dry writing about research, that kind of thing. And so I'm starting to do more creative writing, doing writing about the natural world, about myself, about my family, friends, that kind of thing. I'm also doing a lot of crocheting. It's that time of year. I do a lot of hats, beanies, caps for family and friends. So I'm doing that. But one thing that I am doing related to dysmorphology is that I've decided that it's important to kind of look back and think about the things. I mean, there have been so many incredible victories in this arena over the 40 years that I've been involved. And because of that, I think we tend to kind of elide over some of the things that we didn't quite get right. And so I'm writing a commentary. I'm not sure what venue this is going to go into, possibly an OTIS seminar, possibly publication, I'm not sure. But with friends from the MotherToBaby Utah program, I'm working on looking back at some of the things that we could have done better and how those things could still be done better. I want to get that out there to colleagues, not just my own here in Utah, but across the country and perhaps across the world to get comments and feedback on those kinds of ideas. But so I'm still at it as far as just morphology is concerned, and I want to continue to be a part, not just of OTIS, but of the whole the Utah portion of OTIS as well.